And let's talk about something which I'm sure many of you are on, or you know people who are on there, all right? Statins, right? Statins are a class of drugs which we use to lower cholesterol, all right? Cholesterol is the hot topic now in this current few decades, is it not? All right, I'm sure you will know, even if you yourself are not on statin, I'm sure you know someone who's on statin, all right? Okay, examples would be like atorvastatin, or the famous Lipitor, or rosuvastatin like Crestor, or the older generation drugs like simvastatin there, all right? So it seems like half the world is on this statin there, all right? And it's been, to me, overprescribed there, all right? Okay, all right, so what are the side effects then? Okay, firstly, it can affect the muscle. Statins are well known to cause muscle inflammation, all right? It can cause a muscle to ache. It can cause pain even in the muscles there. It can cause it to be tender to touch. It can even cause the muscles to be weak, all right, causing generalized weakness. And this problem can be worsened when you exercise there. In the worst case scenario, all right, the inflammation can be so bad that it causes the muscle protein to break down, causing a condition what we call rhabdomyolysis there. And when the muscle protein breaks down, it can cause kidney failure, all right? And unfortunately, this has happened quite more than a few times in the past there, all right? Right? And kidney failure, as you know, is not a nice thing to have. Yeah? All right, the next side effect is that it can cause inflammation of the liver. That's right. I'm sure some of you who have taken statins before will have noticed your liver enzymes have gone up. This is because of the statin side effect causing liver inflammation there. In some cases, the liver inflammation can be so bad, you know, that the liver enzymes run into hundreds, you know, the value, the AST, ALT, etc., goes up way high into even thousands as well. I've seen for myself there, all right? Now, what can happen? Well, when you get the very bad liver inflammation or chronic low-grade inflammation, it can cause scarring of the liver, resulting in cirrhosis there, all right? So those of you who are taking statins, do take note. Get your liver function checked regularly there. All right, don't simply dismiss, oh, it's just mildly elevated, you know, it's okay, you know. Well, this kind of chronic inflammation of the liver can lead to more serious conditions down the road there, all right? Now, it can also affect the brain. It's well known now that statins can result in decline in cognitive function and memory loss as well, right? In the elderly, this can cause confusion there. Now, this decline in cognitive function is very often, unfortunately, attributed to aging. Oh, you're getting old, that's all. Don't worry, this happens all the time when you get old. Well, I got news for you, folks. Statins definitely increase the risk of decline in cognitive function, all right? Worsen your memory loss there, all right? So don't just take it as natural or due to aging, my age. No, I wouldn't buy that there, okay? Now, statins can increase your blood sugar level and increase the risk of diabetes, right? The longer you take the statin drug, the risk of dysglycemia or abnormal blood sugar level and the risk of diabetes increase. In fact, studies have shown that you take the statins for 2 years or more, the risk of dysglycemia and diabetes goes up a lot there, all right? So be very careful if you are already a diabetic, okay? Now, statins can also affect the heart. It can weaken your heart muscle, causing what we call cardiomyopathy, all right? When you get cardiomyopathy, your heart function will weaken there. Right? It can cause heart failure. And I see this as ironical. In the first place, statins is supposed to help to improve your, well, reduce the risk of coronary heart disease, and yet it can cause cardiomyopathy, weakening your heart muscle. This is very, very ironical there, okay? So be very careful there, people with heart conditions. So what do statins do really? All right, yes, it reduces the cholesterol production in the liver by inhibiting an enzyme called HMG-CoA reductase. But unfortunately, when the statins inhibit this particular enzyme, you also inhibit the coenzyme Q10 production, right? This is because the coenzyme Q10 production shares a common pathway with the production of cholesterol because they use the same enzyme, the HMG-CoA reductase. So when the statins inhibit this particular enzyme, you inhibit not only cholesterol production, you also inhibit the production of coenzyme Q10. So what's coenzyme Q10, you may be asking, all right? Well, guess what? Coenzyme Q10 is extremely important for energy production in a cell, in the mitochondria, all right? Is this energy which powers the cell, which enables the cell to function normally. If your cells don't have this energy, well, guess what? The function of your tissue and organ will be affected, all right? Second function of coenzyme Q10 is that it's also an antioxidant for the cell. It mops up the free radicals, preventing or reducing the damage from these free radicals. So if your cell lacks coenzyme Q10, all right, what's going to happen is that, all right, the free radicals can cause a lot of damage to the cells, all right? And on top of that, your cell's not going to produce enough energy to function normally there, all right? And further bad news for you is this: your level of coenzyme Q10 will decline as you age as well. So when you take statins, you further decline the coenzyme Q10 in your body. This is really, really bad for you there, all right? So you've got to be really careful. Those of you who are taking statins, who are considering to take statins, all right? You must bear all these factors in mind. And well, further news is this: statins don't reduce the triglycerides at all. All you know that triglycerides is the bad fat, all right? The higher it is, the better it is for our body. Well, statins don't reduce triglycerides. So if you have got high triglyceride level, you might want to consider other alternatives like omega-3 fish oil, the astaxanthin there, all right? Because these can help to reduce triglycerides there. Now, those of you who want to take statins, well, you might want to, or don't want to take statins, rather, sorry, you might want to consider other alternatives there, all right? You can consider plant sterols, red yeast rice, niacin, all right? You can consider probiotics. Yes, probiotics does help, but not very significantly, but it helps. Okay, it's got other health benefits as well. Or you can consider a product called lipid trim there, which I will talk briefly, all right? So in view of all these side effects there, all right, you got to use statins judiciously there, all right? If you have got to use statins, please take the coenzyme Q10 supplements there, all right? This to me is non-negotiable, all right? So the very reasons I just explained there. All right, so I mentioned fish oil just now. So for those of you who have got high triglyceride level, you can consider omega-3 fish oil there, okay? So what can omega-3 fish oil do for you there really, okay? Well, it can help to maintain normal levels of cholesterol, all right? It can help to increase your good cholesterol, HDL, all right? It can potentially reduce your LDL as well, okay? Not as much as statins though, all right? Okay. Right? But it does help to some extent there. And it can also help to maintain a healthy blood pressure, right? Helps to maintain normal blood flow because, all right, it reduces the risk of abnormal blood clotting. All right, prevent the blood from being sluggish there. All right, as I mentioned earlier, it helps to reduce triglyceride level. Right, it helps to improve overall cardiovascular health there. Numerous studies in the past have shown this there. All right, and on top of that, other benefits to boot, it helps the complexion, it helps your mood as well there too. All right, okay. So when you choose a fish oil, the number of factors which I want you to consider. Firstly, is the source of oil from big fish or small fish there? Ideally, we want it to be from small fish like sardines and anchovies there, all right? This is because, all right, these small fishes have got a short life cycle, short lifespan, really, all right? Therefore, they don't accumulate that much toxins and heavy metals from the environment, unlike a big fish, all right? Now, for this particular oil product that I mentioned, all right, they are sourced from the small fish, the sardines and the anchovies. And these small fishes are harvested off the coast of Peru, which the waters of which are relatively unpolluted there. Okay, and then the next thing you want to consider is, does the fish oil that you take meet or exceed standards set by authorities there? All right, and for this particular oil, I can tell you it meets and even exceeds the standard set by the Canadian, the European, and even the US authorities as well. Okay, now next consideration is this, right? Is your fish oil that you're taking molecularly distilled, right, and independently tested after that by another company? Well, guess what? This particular product is there, all right? It is molecularly distilled to remove any possible remnant toxins and heavy metals there, all right? It has got to pass through, what, more than 200 quality checks during the production process, all right? This oil is not tested once, but twice, once by the manufacturer and then by another independent testing company for what? For mercury, lead, PCB, and other heavy metals there, okay? And then this oil has got vitamin E, natural vitamin E added. Why? To prevent oxidation of oil. That's right, ladies and gentlemen. Fish oil can become oxidized. And when they are oxidized, they become rancid. They are toxic to our body. All right, that is why some of the fish oil products out there has got a very strong fishy smell the moment you open the bottle. I can tell you this, they are very likely to be oxidized already. Well, for this particular heart health omega-3 fish oil, right, you have got a natural vitamin E added to prevent oxidation there, all right? So that is why this product does not have that strong fishy odor at all, right? The next factor you want to consider is the amount of EPA and DHA. These are the two most essential omega-3 fatty acids, that we want, all right? Okay, the EPA and DHA. All right, and I can tell you for this particular, each serving of 2 pills, all right, gives you 3,000 mg, all right, of omega-3 fish oil. And of this, right, 900 is EPA and 600 milligram of this is DHA there. All right, that is very, very high. So in other words, each pill has got 1,500 of omega-3 fish oil and 750 out of which 750 milligram is EPA and DHA. All right, that's very high. In fact, it's one of the highest in the market. There are a few others in the market as well. But okay, right. So, and the good thing about this particular EPA and DHA is that they have got a ratio of 1.5 to 1, which is ideal to reduce inflammation. There, studies have shown that this is the ideal ratio to reduce inflammation in our body. All right, so choose wisely, all right? Do consider all these factors if you will have to choose the omega-3 fish oil there. Now, I mentioned lipid trim just now there. Lipid trim, this particular product, okay, heart health lipid trim, can help to reduce cholesterol, among other benefits there, okay? It can help to promote healthy cholesterol production, healthy levels of total cholesterol, the LDL cholesterol, and triglycerides as well. It also helps to promote healthy cardiovascular function and healthy blood vessels there, provides antioxidant support for the heart. Right, so what are unique points about this particular product? Well, it contains this proprietary extract called caprose. It basically consists of Indian gooseberry fruit there, right? This particular fruit extract is well known, has been well studied as well. It's been shown to increase the HDL, right, the lipoprotein to transport the excess cholesterol away from the heart and back to the liver for metabolism and elimination there, right? And it prevents also the oxidation of LDL particles. That's right. Ladies and gentlemen, it's not, bear in mind that very often, all right, it's the oxidation of cholesterol that's much more important to me, all right, than just a pure number of the LDL there, all right? Especially the LDL particles are much more important than the LDL there, okay? These small, dense LDL particles are the major culprits in causing heart disease there, not the big fluffy LDL particles there, all right? So measuring the LDL alone is not enough there. We need to know, ideally, the small dense LDL particles there, all right? And we also need to prevent the oxidation of the LDL there. right, in order to reduce the risk of cardiovascular disease there. Now, this particular product also contains this citrus sinensis fruit peel there. So what does this particular fruit peel contain? Well, it contains this flavonoids there, all right, called PMFs for short there, all right? This PMF compounds help to support normal triglyceride and cholesterol levels. How does it do so? Basically, it inhibits, all right, the enzyme that's necessary for triglyceride production, all right? It also increases the metabolism of fatty acids that helps to burn the fatty acids, really, okay? That's good, all right? It also inhibits another enzyme that's required for production of these LDL particles, therefore reducing your LDL levels there, all right? So that's how, these are the benefits of this particular product there. Okay, now I talk about coenzyme Q10 just now, isn't it? Especially for those who are on statins. Okay, so what can coenzyme do for you? Well, basically it can benefit people with cardiovascular diseases there, all right? Okay, it can help to reduce the risk of repeat heart attacks. Studies have shown this. Studies have also shown it helps to improve outcome in people with heart failure. And there's no wonder, because your heart is what is the organ of high metabolism, meaning that it requires a lot of coenzyme Q10. If your heart is weak in the first place, it tells me that you don't have enough one of the factors that contribute to heart failure could be because of lack of coenzyme Q10. So by increasing the coenzyme Q10 supplementation, all right, you can potentially help to improve a weak heart or heart failure. Now, coenzyme Q10 has been known to help to lower blood pressure as well. All right, and as I mentioned, help to combat the side effects of cholesterol-lowering statins. All right, so coenzyme Q10 has been shown to have cardiovascular protective effects. Right, coenzyme Q10 is abundant in organs and system that uses the most energy. So the heart is one of them, as I mentioned there. All right, other organs would be the liver, kidneys, right, pancreas, brain, immune system. All right. So it's a powerful antioxidant, helps mop out free radicals. Okay, it also helps to increase energy level. Right. So what's so unique about this particular product I just showed you? Well, it's isotonic capable. Okay, when it's isotonic capable, right, it helps to maximize the absorption and the bioavailability of the supplement that you're taking. All right, and that's what we want. We want to get more bang for our buck, isn't it not? If you just simply take a pill, a lot of the active ingredients just simply get washed out through the other end there. All right. On the other hand, an isotonic capable product helps to maximize the bioavailability of the active ingredient where we want. Okay, and each serving of this particular product, right, gives you 100 milligram of it there. Right. So that's pretty high amount there. Okay. Okay.